posture is everything in terms of correcting pelvic floor disorders. So being aware of whether or not you're in an anterior or posterior pelvic tilt is very important. However, it doesn't mean one way or the other that that is the cause of what you're dealing with. It's just good to know if you're anteriorly tilted, because you can do exercises for the hip flexors to reduce the pelvic tilt and bring yourself back to balance. And vice versa, if you're in a posterior tilt, we know the back of the body, the hamstrings and the glutes are tight and pulling your hips down and underneath you. So I like to think of the posture as a great way, as a litmus test to see where you are in the program, how far you've come. Because a lot of guys, when they start to get a lot of relief from pelvic pain, they've told me that they're out of anterior tilt or they're out of posterior tilt. They're more neutral. So there's absolutely a correlation between the two, but one doesn't mean that you're going to, like, there are plenty of people out there with anterior tilts, posterior tilts that don't have pelvic pain, right? But bring yourself back into balance is the purpose of the course.
What are the most common compensation patterns in most patients?
The most common compensation patterns for people with pelvic floor dysfunction are absolutely, um, you know, really the anterior and posterior pelvic tilt. It's a sign of extreme overuse of the hip flexors or too much sitting. If you sit too long and you have the hip muscles folded and half contracted, I like to tell people, if you were to bend your arm for 3 months and never open it, at the end of the 3 months you'd open your arm and it would be stuck with tissue tension, right? So gamers, people that are sitting for work all the time, the hips are getting chronically tight because they're always in a folded position. So then when they stand up, the hips tilt forward, right? There's a compensation pattern there. Conversely, you get people who are very active in sports. They're using their hamstrings all the time. You get swimmers doing a flutter kick. Anything that's using the high hamstring for a long period of time is going to tilt the pelvis underneath you and then cause chronic tension that leads to pressure across the pelvic floor.